everyone, I'm Zoya Hassan and I'm here today with Stephanie Liu, the co-founder of Nourish. Stephanie, thank you so much for joining us.
Of course, happy to be here.
Amazing. There's so much to talk about, so much to unpack with everything you've built. But before we get there, why don't you start off by telling us what exactly Nourish does?
Happy to, and great to be here as well. What Nourish does is we connect individuals like yourself with registered dietitians, and we get the services covered by their health insurance. We see patients for all kinds of different conditions, all different age ranges, and we have 2,500 dietitians on our platform to help get you the perfect dietitian match.
Amazing. How did you get the idea for the company? What's the story behind what sparked it? And you were like, okay, let's go all in and start a business.
Yeah, the journey to the idea wasn't as straightforward, but my co-founder, Sam, and I went to undergrad together, and my other co-founder, Aiden, is his friend from growing up. And during COVID, we kind of came together and we started just working through different ideas, ideating on different things. And we all had in our lives, like, different journeys with nutrition, whether it was resolving a GI condition or chronic migraines, or just for myself being really passionate about food and like cooking. We all just like felt this draw towards the preventative healthcare space, specifically around nutrition. And so during COVID was when telehealth started blowing up. We learned a lot about the other different kinds of business models in the mental health space that were taking off. And when we discovered that dietitians were covered by insurance, we were like, wait, no one told us about this. We thought dietitians were something that only like LeBron James would be able to work with. And so we started discovering that it was really difficult for dietitians to take insurance, and ended up building what is now Nourish.
Amazing. So if dietitians are covered by insurance, then why go the telehealth route? Like during COVID, that makes the most sense. But, you know, me as a consumer, how would you convince me to take the telehealth route as opposed to just going and meeting up with a dietitian in person if it does get covered by my insurance?
Great question. I think primarily two reasons that our patients are wanting to see a dietitian through telehealth. One is just the convenience of it. You don't have to go somewhere in person to get the care that you need, but it's on your phone and from the comfort of your home or a cafe that you can get the quality medical nutrition counseling that you need. And secondarily, beyond just offering the counseling, Nourish also offers a suite of tools at your disposal to really help you through your care journey. We have a macro tracking tool that powered by AI, that enables you to take a picture of something and we estimate the calories. And then our dietitians can help guide you through your day-to-day like nutrition journey with these tools that we've built.
Okay.
So I think there's just like a combination of those two factors.
So if I am signing up for Nourish, walk me through it. Like, where do I go? What do I see first? Am I having like, you know, an initial sit down with a dietitian and then we decide a plan? What's the process look like?
Yeah, for a typical person, I mean, you're probably going to see some Nourish ads out there, whether it's on your TikTok or your Instagram feed, or at times hearing about it through your doctor. Like we partner with leading, physician groups such as like One Medical, and you're going to hear about Nourish, and we're going to tell you, hey, you're likely covered by insurance. 94% of our patients pay $0 out of pocket. And so once you land on our website, you're going to be taken through this sign-up experience where we learn a lot more about what you're trying to solve with nutrition, and we help you get matched to that perfect dietitian. So it could be things that like the things that you're trying to work on, the cultural background that you come from, the time of day that you might want to be meeting with your dietitian. And so we find that perfect match for you, and then we sign you up for your first session. Right after you sign up, you can start using the different tools that we've built, whether it's AI-powered macro tracking or the ability to browse our recipes and like order food on our app. And then you'll have your initial consultation. And from there, like the overall philosophy for Nourish is to be as personalized as possible. So you'll work with your dietitian to achieve the goals that you want. And we're really proud to show that 82% of our patients like achieve their health outcome, and like 90+% patients end up reporting an increase in health and wellness.
Awesome. Yeah. When it came to partnering with the insurance companies, what was that process? did you have a hard time convincing them, or was it like easy breezy?
Insurance companies have been covering medical nutrition therapy, which is a service that dietitians provide, since the beginning of like early 2000s, but it hasn't been a widely used service. And part of that was just access, and part of that was coverage and awareness of the coverage. When we first started partnering with insurance companies, we were just using the plain off-the-shelf contract. So we went directly to the insurance companies and just worked state by state to getting contracts. At this point, Nourish has 2,500 dietitians on our platform. We've served over 100,000 patients. And so we're working more closely with the insurance companies to try to partner more directly with them and also help them drive the health outcomes in the patient population that they want to see.
What about getting the dietitians on board? Where did you find them?
Yeah, I mean, we've really have had amazing word of mouth referrals on our dietitian side. I think that one thing that we stress is that we really want to be the best place for dietitians to build their career and to practice outpatient. And so most of our dietitians are just word of mouth and referrals. We do try to go out and do job postings and recruit individuals, but we found that Nourish dietitians also just love referring other dietitians to Nourish.
Amazing. As a consumer, I see things like Nourish and all these other health apps, and there's almost a level of like trust that you need to have when you're like, oh, should I sign up for that? Like, is it gonna help me? Because part of it is because it's like online, So how do you build that trust with your consumer, making sure that they know that this is something that they can trust?
Yeah, great question. I mean, there's just so much information online, so much misinformation online, and confusion around nutrition. So it's not so clear who to trust at times, right? And so I think how we think about this is on like two dimensions. One is that the people that you're seeing are like licensed medical professionals, right? They've gone to school. It's not just someone who's like calling themselves a nutritionist on Instagram or TikTok, but someone who actually has accreditation in the schooling to really help you with your journey. And the second part is really trying to build that trust up front with our patients through comprehensive like outcomes work and just proving out the clinical pathways that we have with Nourish and trying to get that clinically validated, and really just proving to patients that we can drive the health outcomes that they're looking for.
Absolutely. So what was, zooming out a little bit, when you first decided to start this, what was the process? It's one thing to have an idea, another thing to actually run the business. So what were those first steps you had to take as a first-time founder?
Yeah. For the first few steps that we had to take as a first-time founder, I would say it didn't always go off to the perfect start. But the biggest thing for us was just really committing to an idea and realizing the steps that we needed to do to have that happen. For us, we were really lucky to be accepted to the accelerator program Y Combinator early on. And so we had like a good launching ground for really helping us understand and refine our approach to like solving problems. And YC has this motto, build something people want. And so since the earliest days, we've been really focused on just like, hey, instead of getting distracted by everything else, are we actually building something people want? And then from there, we were able to raise some initial funding, which helped launch the initial version of Nourish's platform, which was very much not like the platform today. It was very much, on the back end, we were manually doing a lot of different processes. But that's what it took for us to really understand our users and understand what we needed to build.
Was it nerve-wracking at all to jump into starting a business?
In the earliest days, a little bit, but what I will say is we started a couple other ideas in small businesses before Nourish. And so we got a few reps at it before Nourish really took off. And so I think at that point we had just like gotten used to just constantly launching. That was what YC also instilled in us, which is like constantly launch, constantly hear back from your users. And so in that sense, we'd gotten more desensitized to it all by the time we really started launching Nourish.
Any key lessons learned in that process that you would put forward as advice to other young entrepreneurs?
If I were to go back and give myself advice, I would say that taking a bet on yourself is almost always worth it, and being unafraid to ask other people for help and input. I think as a founder, I've become so much better at my job when asking others for feedback or just being very honest with things that I don't know, because so many people have done versions of what you're trying to do and you don't have to go at it alone. And so I think those have been like really key learnings.
Amazing. That's great advice. Is Y Combinator something you would recommend to an aspiring founder?
Absolutely. We really loved our YC experience. I'm still really close with our YC founder, Jared Friedman, who's been awesome. I think that YC, especially as a first-time founder, provided an amazing platform for us to just really understand how startups worked, how to focus on the problems that really mattered, and then also have a lot of founders who are willing to give back and advise young founders and provide their perspective. And it was just incredible access to some of the world's best founders that we wouldn't have otherwise had. So whenever I do get an email now from another YC founder who's like earlier in their journey, I make sure to pay it forward.
When you say problems that actually matter, what does that mean to a founder in their early journey?
For founders, it's really hard to stay focused on certain problems and like the crux of what matters. So for example, for Nourish, we could be, building a lot of different kinds of products. We could be integrating with grocery stores, and we can be adding different kinds of providers, and we can be scaling our like existing platform. How do you choose between those sets of problems to go after? And they might all make sense at different points in time, but really trying to narrow the focus and make sure you're focused on, how do I best spend my like hours as productively as possible is something that's always like a challenge at times.
And when you were initially raising money, I know you came out of Y Combinator with some funds raised already, but when you went to, the other investors, what was that journey like?
We were really lucky to be in a position where we didn't have to raise money when we did raise money. And so the business was incredibly healthy. We had years of runway left. And so we were in a really lucky position where we wanted to see if there were partners that we really felt like could help accelerate the business. And we had some inbound interest and partners who we felt like could meaningfully help us be sharper about our business and drive our business forward and like achieve the mission of outcomes for Nourish even faster. And so that's kind of how the round came to be. It was based off of relationships, based off of some inbound interest, and our desire to really try to accelerate our progress towards our ultimate goal.
Yeah, a lot of founders have a hard time fundraising. Any advice for them on things they should do?
Yeah, I'd say that fundraising is just a number at the end of the day. And as long as you're building a very great sustainable business, that's what matters. And so focusing on those inputs that are going to help you, make sure that your business is sustainable, it has great unit economics, it has a great growth trajectory, like doing whatever it takes on those dimensions is going to be key. And then hopefully the funding will follow. It's always easier to raise money when you don't need money. So that would be my advice there.
Absolutely. Well, since you're the CTO, I
Yeah.
want to get into the technology of it all.
Yeah.
Tell me what happens on the back end of Nourish. What do you have to pull together? What strings are you pulling to make it happen to the consumer?
I'd say that Nourish's product is focused on 3 key areas. The first is how we match patients with providers. So we invest a lot of energy really trying to understand the profile of a patient that's coming in. We've used AI to help match patients and providers. We use a lot of signals that we've collected over time to ensure that you're getting the best provider. Then the second part is we really care to enable you to meet with your dietitian as frequently as possible and be able to message them and engage with them and share information back with them. And so we build like a whole suite of products around that, such as messaging, ability to manage your appointments and such. And then the last part of it, I think, is the most exciting part for me, which is a lot of the AI like features that we're building right now. So whether it's AI helping like analyze all of the macros of your meals and pointing out trends, or enabling our dietitians to have AI tools such as like AI scribing their chart notes or AI meal planning, or even an ability to gain insights for different trends or behaviors through AI. We're really doubling down on a lot of features there. Patients and providers all love it, and we think it's like critical to our future mission of driving better health outcomes.
Were you using AI from the get-go when you first started the platform, or is it something that you just introduced recently?
We introduced the first feature using AI about 2 years ago. And it was honestly not since the earliest days, but since, ChatGPT and all of these LLMs have really taken off. And so now I think our team is we're building AI first, and that's really important for us too. And I think it's just such a critical tool for us to be able to have in our back pocket to improve care and like health outcomes at a bigger scale.
What role do you think AI can play in the healthcare industry at large, especially with telehealth and all of that? Where do you see it in, a couple of years from now?
I see AI really having a huge role in how healthcare is delivered in a few years from now. You already see people online, on Twitter, wherever, talking about their AI, like how they're using ChatGPT as their therapist, or they're like getting a second opinion on like a relationship dynamic and such, right? And so AI, I think, is going to really change how we think about care delivery. In particular, I think there's a lot of opportunity for AI to personalize a lot of care delivery, to help people who don't have access immediately to high quality clinical care get it way faster. And then I think it enables the providers at the end of the day to focus more on what matters and what is uniquely done by a human, which oftentimes is like accountability on like the human connection part, and not so focused on like, okay, let me type my chart note, or let me like just respond and make sure that you can get your message like your appointment moved around this week, or just baseline messaging.
Mm-hmm. What about using AI as, a business leader, as an operator? Have you found any tools that have helped you do day-to-day business?
Yes, absolutely. Like our team is definitely AI first in how we operate as well. So whether it's using AI to help like put together a summarization of learnings that you have, whether it's using AI to help me prepare today for this interview, like I threw that into AI. And then very technically too, like all our engineers love using the AI tools to help enable them be both more accurate and faster in how they code and release new products.
Amazing. And you yourself are a software engineer by trade.
Yeah.
Tell me a little bit more about life before Nourish.
Yeah, I grew up in Arizona. I'm an only child, and my parents immigrated from China before they had me. And so kind of grew up in this like multicultural household where food was very much the center of how, we connected as a family. Then I moved for college to New Jersey. I went to school at Princeton, where I studied CS in undergrad and met one of my co-founders, Sam, and then moved out to San Francisco to be a software engineer. Felt like that was the place to start my software engineering career. So I was out there for 5 years before more recently moving to New York.
Amazing. So you went from employee to founder. How has that kind of impacted the way you treat your employees?
I'd say that the best part about like being a founder is that you get to choose the people that you work with. And if anything, being on the other side of things has given me a lot of empathy for just how difficult the work is. It takes a village to build a company. It's not just about the founders. We just passed 100 employees recently. Like even if I were to, work double the amount of hours that I am right now, it would not make that much of a difference. It's about mobilizing everyone together and making sure that everyone's tied to the mission. And so having been on the other side of it, I just really understand, how difficult the job is and making sure that we're building the best team that there is.
So what does a day at Nourish HQ look like?
One of the core values of Nourish is making work feel like play. And so we have a lot of play and a lot of fun at work. Our office is dog friendly. We have a dog named Luna in the office who just like greets people with like the best smile and is always wanting to play with a ball. But overall, we have a very heads down culture. We try to be asynchronous in how we communicate, partially because half of the team is remote, and we try to be very documentation forward, and then have decisions that are very much like agenda driven and focused on pre-reads and really taking a book out of like the Amazon playbook of how to run meetings and having that philosophy of, making sure that everyone's time is best spent being very prepared and being very focused on just like using writing to communicate decisions and thoughts.
Amazing. In the long term, what do you envision happens to Nourish? Is it something you want to see through the end? Would you IPO? Would you want to sell it? I don't know. What's your vision?
We want to swing for the fences. Yeah. So I'd say that the IPO is obviously the dream, but beyond those metrics, really what we care about is just having impact on health outcomes at the largest scale that we can. And so whether that means like what the company does at the end of the day is less important than us achieving our mission. And then on that front, I think our bigger product vision for Nourish is really this comprehensive preventative health platform. We want to use like food as this connective tissue between all other kinds of preventative health services that you can utilize to make sure that we're really helping you be the best and the healthiest that you can be over like your different journeys and life phases.
What do you predict is going to happen with the wellness industry in the next 5 to 10 years?
For the longevity and like the health and wellness interests, I think it's only going to continue. America's like the sickest that we've ever been before. We're spending the most that we've ever spent on healthcare, yet our like health outcomes are the worst that they've ever been. And I think there's just like frustration and feeling of individual consumers wanting to take control over their health and being like, this can't be how healthcare should be done. And so I think the focus on preventative health, the focus on, like early signals, addressing chronic conditions before it comes down to surgery or medication is only becoming like more and more mainstream. And the concept of food as medicine, which I think, historically hasn't been so much of a focus, is now, talked about in the news and amongst like, politicians all the time. And so I think this is only something that's going to be increasing in focus over the next couple of years.
What's the best way to market a wellness product? What has been successful for you? A specific platform or paid media? What does it look like?
In terms of how we reach patients, we definitely do paid ads, but we also invest really heavily in, provider partnerships. And so this looks like partnering with like health systems or payers or individual doctors to get referrals for patients. And so kind of the non-answer to your question is that we attack it from all angles. There isn't any channel that we're not interested in pursuing. It's just a matter of focus and prioritization for us.
Do you track the demographics of who your patients are? Have you seen a certain kind of patient more than the other?
Yeah, we definitely track the demographic of our patients. It helps us really understand what kinds of patients are looking for what kind of care and how we want to better staff our dietitians to serve the patient population that we have. I'd say the biggest trend, actually not so much demographic based, is just how many GLP-1 patients we've seen. Yeah. There's just been an explosion of individuals using GLP-1. And so more recently, really excited to announce that like Nourish has like a new GLP-1 off-ramp program and a GLP-1 companion program for individuals who are either thinking about going off of or wanting to go off of the GLP-1s, or individuals who are currently on GLP-1s and wanting to work with a dietitian to prevent side effects and make the medication that they're taking more effective in their weight loss journey.
Yeah.
And so that's been a huge trend for us and something that's really interesting for us to continue to invest in.
Yeah, it's the Ozempic era.
I know. Yeah, it's we see it in the numbers.
Okay, amazing. Well, I want to go back to you for a second. How has being a founder changed your life?
Being a founder has, I think for me in my life, made me just a lot more confident in how I navigate situations and being more willing to be wrong and understanding that it's okay to be so. Like, I think when I was growing up, I liked to be the one that had the right answer in the class, that I always wanted to be like, the smartest one in the room. And I think being a founder is a very humbling experience. You learn that you're not going to know it all, and you're going to have to hire people that you admire, that you want to learn from, but that's going to be what helps you grow the most over time. And so I think that's been something that's perhaps changed in me the most over the last couple of years.
I love that. Is it true that all founders kind of band together?
Yeah, there's definitely a lot of camaraderie around founders. And I think there's just certain kinds of pressure, or, you really want this to work out. You are so invested in the mission. You feel so much personal responsibility for every hire, for every decision that gets made. And so I think there is this kind of like level of like expectation and stress that founders put on themselves that is just a lot more easily relatable if you're also a founder.
Yeah. Do you have any hot takes on like the founder community, or what, if there's something that you think they should prioritize more, or I don't know, I think about that sometimes.
Yeah, that's a good question. I think my hot take would actually be that a lot of people perceive being a founder to be very, very risky or incredibly stressful. And while it is risky and stressful, my take is that a lot of people overrate the amount of risk and stress associated with it. Like we are just, I think when it comes to like adaptability, humans are just incredibly adaptable to stress levels. And then when it comes to like risk, I think people underrate like how you're taking a bet on yourself, and that you should be confident in that. It's like risky to be taking a bet on someone else at times. And so when I was like when I was a software engineer and like evaluating companies, I didn't know like who the founders were. I didn't have a behind the scenes look at the financials, but as a founder, you have control over all of those things. And I think the ecosystem has become very, very like funding wise, and just like, in terms of like possible exits, the ecosystems have become very, very founder friendly too. And so for anyone out there who's like on the cusp of it, I always think people are like, oh my gosh, how did you get around to like stomaching the risk? And I kind of just like, hey, look, actually, I think there's just maybe a misperception of the riskiness of being a founder. And if anything, I think it's most risky not to take a risk, like a bet on yourself. And so, yeah.
Amazing. Well, if you could give one piece of advice to your 18-year-old self looking back, what would you tell her?
I would really encourage myself to continue to just pursue any interests that I have. I think that what ultimately drove me to entrepreneurship is just the desire to always be learning. And I felt like, I was always looking for how to maximize my learnings. And I felt like just doing everything yourself was like the fastest way to learning everything. And so I would just say to like continue discovering those passions and hobbies. And then the other piece of advice I would probably give myself is to take a little bit more AI related courses, but hindsight 2020 there.
Yeah, me too.
Yeah.
Well, thank you so much for joining us, Stephanie.
Of course. Thank you so much. This was wonderful.